Hi, Dr. Joe here to tell you about a good deal. Was talking with the Takeda, Takeda representative yesterday, and she handed me a brochure. It says "Help at Hand." Now, I find it very hard for you guys to read it, but this is what it looks like. What's so cool about this? They're providing access to medication for uninsured families and individuals. And there are big savings. You have to be using their products, of course, but they do an awful lot. They're very big, and they're big in Japan. So I would go to their website and look for this, Together RX Access, and there's a lot of information on Together RX Access, all one word, .com, or call toll-free at 1-800-444-4106. What kind of savings do you get? Well, let's go down here. They talk about it specifically. $45,000 a year for a single person. For a family of two, it's $60,000 a year. And for a family of three, it's $75,000 a year. Family of four, it's $90,000. Family of five, it's $105,000. Well, I don't know if you can take advantage of all these. You have to have the need for the medication and what have you. But it's nice to know it's out there. But you know what else? This is no different than many other pharmaceutical companies right now. I bet if you go to virtually every single website which your drug is on, they're not generic, they're not El Cheapo, they're not to be taken off the market in several more countries, like it's happening to a lot of the medications that are going generic. You want to have your brand name there, and they want you to be aware that your health really requires you have that medication. Some of this is just marketing, but most of it is not. You got serious savings, and it's really good for you. So go to any website that has your medication on it. Look it up in Google first, and after that, take it to where you'd find the companies doing it, and download the coupons. Everybody has savings. We have all kinds of drugs we use that are just plain free, and some that are $15 a month for a longer period of time. And all of this is really helpful. It maintains your health. Now, philosophically what we do is we try to get everybody really well under medications and then remove you from the prescription drugs. We're doing better and better. We're doing it in the place of most hypertensive medicines. Anybody who's taken a hypertensive drug said, you're on it for the rest of your life. Well, that has to be the worst truth, if you will, that you've ever heard. We take people off all the time. This is especially how you do this. You have certain testing is done. You define how well you're doing it. You do well on it to the point where we can measure blood pressure, for example, but more the flexibility of the artery, more the situation where you're actually reducing the plaque, endothelial lining. Those three components in an artery make a big deal. And that, when you measure and you're 15 years old in your arteries, you know you're in a place you can stop the prescription drug. We keep it in its place with the arginine, but you're doing something really good for yourself, and once you've gotten into this really good place, you probably can do very well. I hope everybody can, and we don't know that. Medicine's not like that, but all they're doing is making you healthy. The more healthy you are, less medicines you need. It's your time.